I'm Dr. Catherine Siengo Mutisia. I am a psychiatrist, and on 10th of October, worldwide, we commemorate the World Mental Health Day, which is a day we create awareness about mental health, mental disorders, how to promote good mental health, how to prevent mental illnesses, and to also get people understand how do I know when I have a mental illness, how do I seek help, where are the places I can be able to seek treatment. So this is a day commemorated every year, and this year's theme recognizes the inequalities when it comes to access to mental health. COVID-19 has also brought in a lot of inequalities, that the gap between the poor and the rich in terms of like the people who have to work daily to earn an income have really been affected, and so they have been left worse off. And again, those who have mental disorders also, the services have been interrupted, and there was a time that even the National Hospital had to stop having clinics for outpatients, and many people were not able to access their treatment. So COVID-19 has itself brought inequalities, and we always know that the allocation to mental health as compared to physical health has always been low. And it is easy to say I have a headache or I have a stomachache rather than to say I'm sad, I'm depressed. People will even say you're seeking attention, that you can deal with it, you can snap out of it. So this year we want to look at those inequalities and what are individuals, governments, communities doing to bridge that gap and to try and close it down. Yes. We know that 1 in every 4 people have suffered or will suffer a mental health condition in their lifetime. So like here we are 4 of us, so at some point one of us will suffer from a mental health problem, so it is that common. We know that 20% of children and adolescents who, in Kenya, our population is youthful. Generally in Africa, we have more of young people. So 20% of them having mental health conditions is significant. And we also know that by age 14, which is quite young, that many mental illnesses have set in. And by the age of 21, 23, those who have genetic predisposition to mental illness will have developed them. So this is a huge burden in Kenya, and a research done showed that 50% of people accessing healthcare in a general hospital, let's say for example you go to Kenyatta National Hospital or you go to Bagathi Hospital, and you sample among those waiting to be seen, 50% of them have a mental health condition which either has not been identified or they do not know they have it. So like for example, you will have a child who complains of stomachache when it's time to go to school, but they have anxiety of going to school. You might have a lady who is complaining of headaches, but they are depressed. You might find people who will even stop to talk, stop to eat, stop going to work because they are depressed. So mental health problems are quite common in our country. I would start by defining what we would want for everybody: good mental health. So when you have good health, what do we expect? We expect you to be able to reach your potential. So like a journalist like you to be able to wake up every morning, do their work, also contribute to the community, like what you are highlighting today, you are educating the public about mental health condition. So, and then adjust to adversities. Life will always have adversities. COVID hit all of us. It was an adversity. So if you have good mental health, you should be able to adjust to those adversities, contribute to the community, and reach your potential. So that is good mental health. When we now moving from there, we start talking about mental health problems. A little sadness here and there, problems with sleep, problems with appetite, problems of not being able to reach your potential. Or a stressor comes and it hits you that you're not able to bounce back. So we start talking about mental health conditions. And then when we talk about mental illnesses, now these are conditions which have reached the criteria for diagnosis. So we can easily diagnose you have depression, you have anxiety, you have substance use. During COVID, we saw many people use a lot of alcohol and weed and cannabis because they were at home, isolated, and probably the only solace they could find was to use substances. So we saw a lot of increase in that. And of course, when children didn't go and adolescents didn't go to school for long, that was also a crisis for the young people. So we've had many young people pregnant. Basically, there are three ways of knowing whether you're unwell, mentally unwell. Like if your behavior changes. So let's say I was a very outgoing person, loved my work, loved interacting with people, reaching out to people. Then I change and stop answering my phone calls, stop not reaching out to people. I don't feel like going to work, or even if I go to work, I don't want to talk to people, I don't want to interact with people. My work performance also goes down. So change of behavior. Then change of how you feel. This you can tell yourself that I'm not being happy as I used to. I don't feel like life has meaning. I don't feel worthy. And again, how do you feel? And thoughts, your thoughts. Thoughts are interpreted from speech and writing. So people will write what they are feeling or what they are thinking, and they'll also verbalize what they are thinking. So when that's why we say, even there's an app where by looking at social media and your post, we can actually be able to pick who is depressed and who is anxious just from their posts, because you write or verbalize what is in your thoughts, and the thoughts can then change, and maybe you used to be a positive person, you become a pessimistic person. So thoughts, behavior, and how you feel, when that changes, you need to seek treatment. It would be good for you to be evaluated, then you are told this one you don't have to worry about it, or you need treatment, rather than to just say it is mild, I don't need. Because even therapy is part of treatment. You don't have to be put on medication always. So just having somebody listen to you, discussing the options available, and hearing you out is enough therapy. It doesn't mean that when you go for treatment, it has to be medication, or it has to be admission, or it has to be intensive. Yes. The Ministry of Health launched a policy in 2016, followed by an action plan, and of course the Mental Health Task Force also has picked several things from the action plan, right from leadership. After health was devolved, we know there is the role of the county and the role of the national government, and we need leadership for mental health in terms of who is responsible for mental health in Nairobi County, for example. Is there a key person who will look out for mental health issues? Because one of the challenges with mental health, when it is all put together with the other health, we will easily look at what easily kills. So COVID is easily killing, malaria is easily killing, childbirth. So then we will rush to that and forget mental health, not forgetting that they are related. So like a mother who is depressed will not remember to take their children for immunization. A mother who is depressed will not even attend antenatal services, and so risking the pregnancy. A mother who is depressed will not take their children to hospital when they're sick, so they could die of malaria. So all those things are related. So by leadership, we want the counties to also have key focal committees, focal persons, just like it is at the Ministry of Health. And so at leadership, we are also looking at promotion of mental health, because most of the time when we talk about health, we just look at the hospitals and treatment, but we forget that it's very important to prevent and to promote good health. So we are ensuring that the action plan, mental health action plan, ensures that we are going to have the counties and the national government have committees which are spearheading mental health promotion programs, prevention of mental illnesses, educating the young people in schools about life skills. So that is on prevention. Then those who get sick, the action plan also has achieved several milestones on making sure that mental health care is accessible, by making sure that all level 4 and above, up to level 6, have mental health services which can be accessed, and also retraining of nurses, clinical officers, who also are the ones who actually do a lot of healthcare in the up country and in lower levels of treatment. So access to care, prevention of mental illnesses and mental health promotion, leadership, and also making sure that these services are of good quality. KMTC, Kenya Medical Training College, which trains healthcare clinical officers, nurses, and whole healthcare providers, started having in their curriculum mental health education, so that every qualified nurse or clinical officer, even if they don't specialize in psychiatry, because a clinical officer could as well come and do a higher diploma in psychiatry, they have those basic knowledge. That means if you go to a health center and you're having a headache, and then the nurse checks your blood pressure, they check your blood sugar, they check your BP, it's okay, then they should be able to tell, then there's more to this. And they should dig out, has anything changed in your life? Are you happy? Is there something stressing you? So that's how it begins. So when you present yourself to the hospital, you're not the doctor. So you go talk about your problems. It's upon the doctor now to diagnose. This is not just a physical illness. I've done all the tests, they are negative, because mental health issues are disorders of exclusion. So I've done all those tests and headache is still there. So then I find out what else is bothering you. And from that, then I can be able to tell. Then we have simple checklists for depression, which are distributed all over, that everybody can be able to checklist for depression or anxiety. Doctors, there's a time when like University of Nairobi, which is the oldest medical university, did not used to examine student doctors, medical students on psychiatry. But for over 20 years now, everybody has to do an exam in psychiatry. That means you take it seriously, you rotate, you do your exam. So by the time you're coming out, you are qualified to diagnose mental disorders. So again, if you're going to see a doctor at a level 4, that doctor should be able to tell, this is not just headaches, this is not just stomachache, this is a mental illness. So they either diagnose and refer, or if they're able to manage there, they manage. Yes. The situation is improving, starting with the Mathare National Teaching and Referral Hospital where I work, that we now have medications for all the disorders, which was a challenge previously. The health, the cleanliness and the meals, because it is now a semi-autonomous organization, so there is more allocation, and so there is more improvement on the food, the uniform, the cleanliness, and of course the medications, which are the most important. But we are also aware that the hospital will have, the government is building a new hospital which has all the facilities, because some of those buildings in Mathare are very old, and when you renovate, you know, it's very expensive to renovate. So the easiest thing is to do a good, modern neuropsychiatric hospital, because in most of the centers you have both the neurology hospitals and the psychiatry hospital are in the same place, because the two disciplines are interrelated. And then the counties, that's why I said the mental health action plan starts what is important for the county, right from leadership and what the counties need to do. And we are working with the key persons in all the counties, together with the key mental health teams. There are mental health teams in every county, so we are working with them to make sure that the counties there are also able to improve on the treatment, the facility, the sanitation, and so things are improving. And I agree with you, when we went round, the places were not good. You could see a very big difference between the psychiatric unit and the rest of the hospital. We know that Kenya Medical Association has come up with a hotline for healthcare providers to be able to call and access a psychologist who will vet and see who needs to see a psychiatrist and who needs to be seen in person and who needs to be checked in hospital. If you look at the officers who work for the government, they also have a medical cover national insurance cover is enhanced, and with NHIF is covering all mental disorders, including substance use disorders. So for those employed by the government, they're actually able to access all the treatments, including things to do with alcohol addiction, substance use, all mental disorders, because the NHIF, unlike private insurances, which will say will not cover anything to do with alcohol or other substance use disorders or what we call addiction, NHIF is not doing that. So mental health workers, healthcare workers in the public are able to access healthcare, and also there's that hotline they can call and be advised where to seek help, the nearest place, and if they need an emergency, then they're advised which hospital to report to. Suicide is surrounded by a lot of stigma, right from our traditional community. That in communities, when somebody dies by suicide, you're not buried the right way. Either you're buried at night, or you don't pass, the body doesn't pass through the main entrance, you have to use a back entrance. So there's a lot of misconception, a lot of stigma around that. And so for those who attempt suicide and end up not dying, then they are faced with a lot of stigma. People will accuse you of being selfish, of not being a believer in God, that you should believe that God will take care of you despite of your problems. And your family will not want to talk about it, because then I had an encounter of some family members who were saying they cannot have an anniversary to remember their father because he died by suicide, and that is encouraging the suicide spirit. So this is somebody you should be remembering, but you're saying when remembering him is associating with suicide spirit, and they don't want to do it. So there's a lot of stigma right from the church and the religious background, the traditional community, and part of the suicide, part of the stigma is worsened by the fact that it's a crime. So if I attempt suicide and I don't die, then I'll be arrested and charged. So again, that makes people not even seek treatment. And those who are already thinking about suicide will look for whatever will make them succeed. So if I have to take a poison, I better take one which will kill me, because if I survive, then I will even go to jail, I'll be stigmatized, I'll live a miserable life. So we have been appealing as psychiatrists through Kenya Psychiatric Association and the Ministry of Health for repealing of that law, that we decriminalize. We are not saying we legalize, we decriminalize. So that if I've found being attempting suicide, then I'll be taken for treatment, not to jail, but not to make it legal. I'm sure you've seen of late, the last 2 to 3 years, there's a lot of discussions on mental health. We've had conferences, mental health conference, every observance day like suicide prevention, World Mental Health Day, International Day Against Drug Abuse, Bipolar Day. All those days, the Ministry of Health takes the opportunity to educate people, and then there are ongoing discussions, even the task force findings, recommendations. We had 2 months of discussions, both online and on TVs and on newspapers. These days, when you look at the newspapers, you will see an article here and there about mental health. So the Ministry of Health has really worked on that, and spearheaded by the CS and the team. They are all very supportive, and we are seeing a lot of mental health talks. You can agree with me, the social media is full of mental health talks, yes. For us to be able to make mental health accessible to everybody, we need to be sure, first of all, to ensure that everybody is aware of what is good mental health, what are mental health problems, and how do I know if I have a mental health problem. So by creating that awareness, then people can realize I need to seek treatment. Then making sure those services are available. And that's why we are saying we are working with the counties to make sure that you can access healthcare in the lowest level from the health center where the nurse will be able to diagnose. And even the medications in the health centers, you have medications for depression, for anxiety, for acute psychosis, so that if you have a breakdown and you go to the nearest health center, you'll be given a first aid even before you are referred. And of course now the hospital to be built will also be a research hospital. We know like now Mathare National Teaching and Referral Hospital, all psychiatrists are trained there. University of Nairobi uses Mathare National Teaching Hospital for research, teaching and training. And many of the medical training colleges, KMTC, they also use the facility. So we want to improve on the research bit of it. There's also a call center being funded by World Bank, which should be open anytime soon, so that Kenyans can call from wherever they are and say, I'm feeling 1, 2, 3. With COVID, many Kenyans learned how to do things online. So we are also improving on telepsychiatry, and we are also encouraging the counties to also be able to do that, because like if I'm talking of a county like Kitui, where they don't have a psychiatrist at the moment, if there's good telemedicine, I can actually communicate from Mathare Hospital with a doctor in Kitui County, see the patient online, and advise the doctor give this prescription even if they don't have a psychiatrist. So we are appealing to the counties to also make use of telemedicine, and we are having call center which is going to be opened soon at Mathare Hospital, so that we can actually be able to access healthcare. I get calls even from Mombasa, from all over the country, people saying, I have this and this and this. Where can I get help? What can I do? So we can easily do that, because now Kenyans and mobile penetration in Kenya is quite high, and internet also is quite high, so that we can actually be able to do what we wouldn't have done without telemedicine to reach everybody in the country.